Today we are going to talk about compensation in clinical trial. Now, content for the today's presentation. First of all, the introduction, then insurance and indemnity, then guidelines by the DCGI regarding compensation in clinical trial related injury, clinical trial related death, and clinical trial related serious adverse event. Then what are the procedures for compensation? How we calculate that compensation by using formulas and the limitations. Now in the introduction, the liabilities of the involved parties, whether it is investigator, sponsor or manufacturer or institution, they must be clearly agreed and stated before the start of the study. Before the start of the study, the liabilities and the responsibilities of all these involved parties should be and must be clearly agreed and stated. One of the major issues which has emerged is of compensation to the research participant for the clinical trial related injuries or death. And the government of India has come up with the regulation regarding compensation for the research participants. Now, insurance or indemnity. This insurance or indemnity includes a contract of insurance, a contract of indemnity, a guarantee, a surety, a warrant, and a bond in any case shall be available to cover the liability of the sponsorer and the investigator to provide for compensation. In the event of any injury, loss, or damage, or the death of any subject arising out of arrangement for or conduct of clinical trial, the sponsor or investigator shall become liable to pay to such subject or in respect of such subject. Now, what is meant by indemnity? Indemnity is giving an undertaking that compensation will be paid. It's an undertaking that compensation will be paid. The provision of written insurance or contract confirming that liabilities will be provided. It's a written insurance. Purpose is to ensure that in the event of injury, there is a facility for compensation will be paid to reinstate. To reinstate. Now that we all know insurance, what is insurance? Is a contract or policy which requires premium to be paid into a fund from which a payment for compensation can be made in the event of claim. Now there are types of insurance policies: clinical trial related insurance, product liability insurance, professional indemnity, no fault type of insurance. So what is by clinical trial insurance? Clinical trial insurance, it indemnifies the insured, means sponsorer, against claim. It indemnifies the insured or sponsor against claim made in respect of injury to any trial participant arising out of participation in the clinical trial. So it is related with the clinical trial injuries or death or serious adverse event. It indemnifies the insured or sponsor against claims made in respect of injury to any trial participant arising out of participation in the clinical trial. Now, product liability insurance. This product liability insurance covers the liability arising out of bodily injury to a trial participant due to use of defective product. Because of use of defective product, if there is any injury to a trial participant, that will cover under product liability insurance. Now, professional indemnity. Insurance protect a professional service provider against claim of negligence and breach of duty. If there is some medical negligence or breach of duty, in that this professional indemnity insurance will going to help. No fault type of insurance. Insurance where the entitlement to the compensation is not linked to the ability to prove that a person injuries were due to a fault of another. There is no such fault, but still there is an insurance. Do we call it as no fault type of insurance? Now, why there is a need of compensation? Because money that is paid to the trial subjects because they have been hurt or because something has been lost or damaged or injured, or in case of death. Means there are two objectives: participation in the clinical trial and trial related injuries. So we have to compensate them. Research participants, we have to compensate them if there is injury, if there is any loss or damage or serious adverse events. Now, ethical concerns mainly it includes undue inducements. It includes undue inducements or disproportionate burden on the poor. Now, what are the ethical issues in the compensation or in the research? Mainly, it induces the or disproportionate burden on the poor, particularly illiterate, unaware monetary inducements can be easily enticing. Vulnerable populations. Vulnerability is characterized as a limited autonomy of the individuals in making decisions, like children's, mentally challenged, poor, illiterates. So all these are the vulnerable population or special population in which we have to take care. Now we have Indian guidelines like ICMR, then Indian GCP guidelines by the DCGI. So what ICMR guidelines says, research participants who suffer direct physical, psychological, social, legal or economic harm as a result of their participation are entitled, after due assessment, to financial or other assistance to compensate them equitably for any temporary or permanent impairment or disability. The research proposal should have an inbuilt provision. The research proposal should have an inbuilt provision for mitigating research related harm. Any research related harm, you should be compensate. Now, these are the guidelines for by the DCGI for the compensation related clinical trial related injury or clinical trial related death or clinical trial related serious adverse event. So compensation in the clinical trial related injury occurring due to any of the following reasons. Injury because of any of the following reasons is considered as a clinical trial related injury or death, and nominees of the subject are entitled for the financial compensation. Means if there is adverse effect of the investigational product, we don't call it as a drug because it is not available in the clinical market. It is still a investigational product. If there is an adverse effect, violation of the approved protocol, of the, if there is any deviation or if there is a changes in some inclusion or exclusion criteria, then we call it as a violation of the approved protocol. Scientific misconduct, if you have taken intramuscular route, you are giving that drug or medicinal product by intravenous route, so we call it as a scientific misconduct or negligence by the sponsor or investigator. Failure of investigation product to provide therapeutic effect, if it fails to give the therapeutic effect, or use of placebo in a placebo controlled trial, adverse effect due to concomitant medication excluding the standard care necessitated as a part of approved protocol, injury to the fetus in utero because of participation of parent in a clinical trial, any clinical trial procedure involved in the study. Now, compensation in clinical trial related death. In case of death occurring in the trial, subject and their nominees would be entitled for the financial compensation, which will be over and above any expenses incurred due to medical management of the subject. It should be over and above any expenses incurred due to medical management of the subject. And expenses of medical management and financial compensation in case of trial related injury or death shall be borne by the sponsor of the clinical trial. So, sponsor of the clinical trial has various responsibilities and liabilities. Means you have to take care of the expenses of the medical management and the financial compensation in case of trial related injury or death. The sponsor shall give and undertaking to the licensing authorities like DCGI along with an application for the clinical trial permission to provide compensation in case of clinical trial related injuries or death. In case the sponsor fails, for what? To provide free medical management for injury to the subject or financial compensation to the nominee of a subject who has died in the clinical trial. In that situation, the licensing authority, after giving an opportunity to show cause, will suspend or cancel the clinical trial. The DCGI or the licensing authorities, they can suspend or cancel the clinical trial or restrict the sponsor to conduct any further clinical trial in the country. Now, compensation in clinical trial related SAEs, serious adverse event. Considering the definition of SAE, the four sequelae other than death are possible in a clinical trial subject in which the subject shall be entitled for compensation in case of SAEs related to the clinical trial. First is the permanent disability, congenital anomaly or birth defect, SAE causing life-threatening diseases or reversible serious adverse event in case it is resolved. Now we'll see one by one what happens if there is a permanent disability. 100% permanent disability to a subject may not be considered equivalent to the death of a subject. If there is a 100% permanent disability to a subject, it may or may not be considered equivalent to the death of subject. Quantum of compensation in case of 100% disability should be 80% of the compensation of the death of subject. It is 80% of the compensation of the death of subject. So quantum of compensation for less than 100% disability is calculated with the help of this formula. C is equal to D into 80 into C divided by 100 into 100. So what is D and what is C? D is the percentage disability the subject has suffered. The percentage disability the subject has suffered in case of less than 100% disability, and C is the quantum of compensation. C is the quantum of compensation. Now, congenital anomaly or birth defect. If there is a conditions like stillbirth or early death due to anomaly, premature death or early death, so in these conditions, the quantum of compensation, such serious adverse event should be half of the base amount for the SA resulting into death. What is the SA resulting into the death? What is the base amount? Is the 8 lakh. So half of the base amount, it is a 4 lakh. So in both cases, where there is a stillbirth or early death due to anomaly, so we have to give the half of the base amount, that is 4 lakh. Then no death but deformity, which can be fully corrected through the appropriate intervention. Permanent disability, whether it is mental or physical, then in that case you have to pay 4 lakh rupees plus medical management as long as it is required. Now serious adverse event causing life-threatening disease. Now how will you calculate that compensation? N into W. What is N? It's a number of days for which the trial subject remained under life-threatening situation requiring medical care irrespective of number of days of hospitalization. That is the N, number of days, and W is the minimum wage per day of the unskilled worker, and that's how we have to calculate the SAE causing life-threatening diseases and reversible SAE in case it is resolved. Compensation per day hospitalization in such case should be double the minimum wages. So 2 into W into N. What is W? It's a minimum wage per day of the unskilled worker. So compensation has been paid by the Government of India, Ministry of Health and Family Welfare since 2005. So you can see there is an increasing total SAEs of death related to the clinical trials. Compensation is also increasing day by day. So something is happening. Now, procedure for compensation. What is the procedure? The investigator shall report. The investigation shall report all serious and unexpected adverse event to the licensing authority, the sponsor and the institutional ethics committee within 24 hours of the occurrence of the event. The investigation shall report. What should it report? Unexpected adverse event. To whom? To the licensing authority, to the sponsor, to the institutional ethics committee within 24 hours of the occurrence of the event. In case of trial related death or in case of trial related injury and serious adverse event, we'll see whenever there is a trial related death, occurrence of a serious adverse event or death, an independent expert committee constituted by the licensing authority, independent expert committee that we have to form, which is constituted by the licensing authority, that will examine the cases and establish the cause of death and recommend that licensing authority to the quantum of compensation. Then ethics committee, after the analysis, forward its report on the SAE or death along with its opinion on financial compensation to the expert committee with the copy of the report to the licensing authority within 21 calendar days of the occurrence of the SAE. Now there is a role of institutional ethics committee. After all the analysis, that committee should forward its report on the SAE or death along with its opinion on the financial compensation to the expert committee, independent expert committee, with the copy of report to the licensing authority. It should send to the licensing authority also within 21 calendar days of the occurrence of the SAE. The sponsor and the investigator shall forward the report on SAE or death after analysis to the ethics committee, expert committee, head of the institution where the trial has been conducted, along with the copy of the report to the licensing authority and the respective head of the institution within 10 calendar days after occurrence of the adverse event or death. The expert committee shall examine the report of serious adverse event of death and give its recommendation to the licensing authority within 30 days of receiving the report from the ethics committee. While examining the event, the expert committee may take into consideration the reports of the investigator and the sponsor. The licensing authority shall decide the quantum of compensation for clinical trial related injury and shall pass order within 3 months of receiving the report of serious adverse event. The sponsor shall pay the compensation for the clinical trial related death as per order of the licensing authority within 30 days. The sponsor shall submit to the licensing authority details of compensation provided or paid for the clinical trial related death within 13 days. So all these are the compensation related rules and regulation. Now, in case of trial related injuries or SAE, the sponsor and the investigator shall, after analysis, forward the reports on SAE to the ethics committee, licensing authority, and the head of the institution where a trial has been conducted within 10 calendar days after the occurrence of the injury. The licensing authority shall decide the quantum of compensation for the clinical trial related injuries and shall pass order within 3 months of receiving the report of the serious adverse event. The sponsor shall pay the compensation clinical trial related injury as per the order of the licensing authority within 30 days. Now, how will you calculate this compensation? Compensation formula for the ACE or death. Compensation formula is the B into F into R divided by 99.7. So, computing three factors, we have to compute the risk, age and base amount. What is the base amount? 8 lakhs. Now, what is the B for B is the base amount is the 8 lakhs. F is the factor depending on the age of the subject based on the Workman Compensation Act. What is F? F is the factor depending on the age of the subject. And R is the risk factor depending on the seriousness and severity of the disease, which may range from 0.5 to 4. BFR. Compensation amount will vary from 8 lakhs to maximum 73 to 74 lakhs depending on the age of the deceased and the risk factor. The formula for calculating the quantum form of clinical trial related injury, as you can see, C square is equal to A into B in bracket 1 minus F into 100 into D into divided by 100. As you can see, what is C? C is the loss of dependency to the family of the injured research subject. D is the permanent disability, it's a percentage disability caused by the research subject due to the clinical trial. A is it denotes the contribution from the research subject salary to the or his family. B is the multiplier connected to the age of the research subject. It is very difficult, but you should know the formulas for calculating the quantum of compensation. Then what are the limitations of the compensation? In which case it is not given. The compensation should not be paid when failure of a medicinal product to have its intended effect or to provide any other benefit to the patient. No compensation should be paid for the failure of a medicinal product to have its intended effect. Then it is not mandatory for the compensation. No compensation should be paid for the injury caused by the other licensed medicinal product administered to the patient for the purpose of comparison with the product under trial. No compensation should be paid to the patient receiving placebo in consideration of its failure to provide therapeutic benefit. No compensation should be paid, or it should be abated as the case may be, to the extent of injury has been arise through a significant departure if the participant departed from the agreed protocol through a wrongful act or default of a third party, including a doctor's failure to deal adequately with an adverse reaction, or through the contributory negligence by the patient also. In all these conditions, they are not mandatory for the compensation. They will not get compensation. So all these are the reference for this compensation in the clinical trial related injuries. Thank you.